practitioner doing your physical exam today. Are you ready to get started?
Mm-hmm.
Good. All right, I'm going to first start by looking at your hands, inspecting your hands, checking for capillary refill. That was good, less than 3 seconds. I'm going to inspect your head. I'm going to palpate your scalp for any lumps. Good. I'm going to inspect your face. Everything looks symmetric. I'm going to check cranial nerve number 7, the facial nerve. Can you puff out your cheeks? Good job. I'm going to check cranial nerve number 5, the trigeminal nerve, the motor aspect, feeling your masseter and temporalis muscles. I need you to clench your teeth. Good. And then clench your teeth. Good. Strength was equal on both sides. I'm going to feel your temporomandibular joint. Open and close your mouth. Good. No clicking there. I'm going to feel your frontal and maxillary sinuses. Good. No pain there. I'm also going to do the cranial nerve number 5, trigeminal nerve. I'm going to do the sensory aspect. I'm going to grab a cotton ball. You're going to close your eyes and you're going to say now when you feel it. Ophthalmic branch.
Now.
Maxillary branch.
Now.
Mandibular branch.
Now.
Perfect. Thank you. All right. Now I'm going to check cranial nerve number 2, the optic nerve. I'm going to check confrontation. That's your peripheral vision. So I'm going to have you cover your eye like this. I'm going to hold my finger out and you look at me and you say now when you can see my finger.
Now.
Good. And then keep that same eye covered. And then say now when you can see my finger.
Now.
Good. I'm going to check cranial nerve number 3, 4, and 6. That's the oculomotor, trochlear, and abducens. It's the 6 cardinal points of gaze. So you're just going to follow my finger with only your eyes. Perfect. Okay. Now I am going to get my pen light. I'm going to check the corneal light reflex, so just look at me. Making sure that the light shines in the same place on the cornea is good. I'm going to do the pupillary light reflex. Good, pupils are equal and reactive. I'm also going to check accommodation, so you're just going to look past my shoulder here and then look at this pen light when I bring it up to you. Good. Now I'm going to inspect the external structures of your eyes. Eyebrows, eyelashes are all symmetric. I'm going to inspect your external eyes. Conjunctiva are clear, sclera is white, pupils are equal. All right, now I'm going to look at the internal structures of your eyes. So I'm going to get up close to you here, okay? I'm checking for a red reflex. And then I'm looking at your macula, retinal background, the vessels, the optic disc, and the ocular fundus. Those all look healthy. All right, now I'm going to go to your ears. I'm going to inspect your external ear. I'm going to palpate your auricle and your tragus. Then I'm going to get my otoscope and I'm going to look inside your ears. And the auditory canal is clear and tympanic membrane is intact. Color is pearly gray and it's flat. Cone of light is present at 5 o'clock and malleus is present. Now I'm going to do your nose. I'm going to inspect your external nose. It looks symmetric. And I'll look inside your nose for any bats in the cave. Good job. That looked good. Now I'm going to inspect your mouth. Say ah for me.
Ah.
Good. The mucosa is moist and your tongue is pink. I'm going to check cranial nerve number 9 and 10, the glossopharyngeal and vagus nerve. And so you're just going to open real wide and say ah.
Ah.
Good job. And the palate and the tonsils rose midline symmetrically, so that's good. No concern for stroke or paralyzation. And then I'm also going to check cranial nerve number 12, hypoglossal. I need you to stick your tongue out for me. Good. It protrudes midline, so that's good. And then can you say light, tight, dynamite?
Light, tight, dynamite.
Good job. Okay, and then I'm also going to check cranial nerve Number 8, the acoustic vestibulocochlear nerve. So this is a whisper hearing test, and this is going to test your hearing, okay? So I'm just going to stand like an arm's length away, and then I need you to take this hand and cover this ear for me. Got it covered? Okay, I'm going to whisper 3 letters, and you repeat them after me.
A, B, C.
Good job. Okay, coming back around to the front. All right, now I'm going to inspect your neck. Can you sit up nice and straight for me? Good. Your neck looks symmetric. Trachea is midline. That's good. No lumps. I'm going to feel your carotid pulse. Good. And I'm going to listen to it too, okay? With the bell of my stethoscope. Can you take a breath and hold it for me? Good. You can let it out. Take a breath and hold it. Good. You can let it out. No bruise there. Now, I'm going to feel your lymph nodes. So I'm going to feel here pre-auricular, posterior auricular, occipital, superficial cervical, posterior cervical, jugulo-digastric, submandibular, submental. And then I'm going to feel your deep cervical chain. So I just need you to tilt your head slightly when I feel on this side. Deep cervical chain. Good. And then hunch forward just a little bit for me while I feel your supraclavicular lymph nodes and your infraclavicular lymph nodes. Good, thank you. Okay, now we're going to go around to the back. So I'm just going to have you swing your legs that way. Like that. Actually, swing around this way first. So I need to feel your thyroid. Okay, and this is where the water comes into play. Hold that cup of water for me.
Okay.
Sit up nice and straight. Tilt your head down just a little bit and to the left. And so I'm going to displace with my right hand and palpate with my left. Take a drink of the water and swallow while I palpate. Good. And then same thing, just turn your head to the right there just a little bit. Displace with my left hand. Go ahead and take a drink of water. And I feel as you swallow. Good job. I'll take that back from you. All right, and then swing your legs back around this way. Off to that side. Now I'm going to inspect your posterior chest. I'm going to feel for any lumps. I'm going to feel your spinous process. I'm going to check for tactile fremitus. So when I place my hand, you say 99.
Okay, 99. 99. 99. 99. 99. 99. 99. 99. 99.
Good job. Okay. And I'm also going to check thoracic expansion. So I'll pinch a little part of your skin here. You take a deep breath in and out for me. Good job. And that was symmetric. Now I'm going to percuss, okay? So I'm just going to be tapping on your back here. And that was good. And then I'm going to listen, okay? So each time I move my stethoscope, you just take a deep breath in and out for me, okay? Do it again. One more. Again. Good job. Now I'm going to check for egophony. So each time I move my stethoscope, you say E.
E. E. E. E. E. E. E. E. E. E.
Good. Now I'm going to check for bronchophony. So each time I move my stethoscope, you say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good job. Now we're going to come back around to the front. Now I'm going to inspect your anterior chest. So this is the front of your chest here. I'm just feeling for any lumps. I don't see any. And then I'm also going to percuss. I'm going to do the same thing. I'm just going to tap on you here, okay? And make sure a placement can be seen on this. That was good. And I'm also going to listen to your heart and lungs, okay? Doing okay?
Mm-hmm.
Good. Okay, so just hunch forward just a little bit for me. Listen to your heart. Good, and then just breathe normal for me. That was good. Okay, now I'm going to inspect your upper extremities, so your arms here. I'm going to check range of motion of your shoulders. So if you could do this for me, up and back behind you, and then up over your head, and then back behind you. Good. I'll do range of motion of your elbows, flex and extend. Good. I'll check strength of your arms too. Okay. So if you could hold my hand and just pull against me. Pull. There you go. And now push against me. Push. Good job. Okay. And then I want to do range of motion of your wrists. So hold your hands out like this. Bend them down and up. In and out. And then close your hands. Open them. Good. And then fingers. Just only your fingers down and up. Good. Okay. And then I'm also going to feel your brachial pulse and your radial pulse. I'm going to palpate your axillary nodes and then your epitrochlear node. So I'm going to have you like shake my hand. I'm going to take your elbow like this and feel. I don't feel anything, so that's good. Okay. Now, you ready to lay down?
Mm-hmm.
Okay. Lay down. Get up there on the pillow. Okay. First, I'm just going to inspect your precordium, and then I'm going to feel for any pulsations or thrills. I don't feel any. I'm going to feel for your apical pulse, and that is the 5th intercostal space mid-clavicular line. Then I'm going to listen to your apical pulse. Sorry. Over here. And that was good. Rhythm was regular and rate was 90. Now I'm going to listen to your heart sounds, okay?
Mm-hmm.
I'm going to do that with both the bell and the diaphragm and the bell of my stethoscope. So we're going to start here, aortic, which is 2nd intercostal space, mid-clavicular line. Pulmonic, 2nd intercostal space, mid-clavicular line. Herb's point, 3rd intercostal space, left sternal border. Tricuspid, 4th intercostal space, left sternal border. And mitral, 5th intercostal space, mid-clavicular line. And then I do the same thing with the bell. Aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fifth intercostal space, midclavicular line. Good. Now I'm going to listen to your aorta. I'm listening for bruits. I'm going to listen to your iliac arteries and your renal arteries. I'm going to do that with my bell also. Aorta, iliac arteries, and renal arteries. No bruits. Now I'm going to listen to your bowel sounds. And those were normal active. I'm done listening. I'm gonna, you can still sit, lay down. I'm gonna inspect your abdomen. Everything looks symmetric. Now I'm going to percuss, okay? So I'm just gonna be tapping. Good. Now I'm going to percuss your liver span, and this is on the right side midclavicular line. I'm just going to percuss down this way until I hear dullness. I'm going to grab my marker real quick, okay? Okay, right there. I'm going to go up. Right there. Going to mark. We're going to measure it. And it's 6 centimeters for the liver span. Okay, and then I'm also going to percuss your spleen, which is over here about the 9th or 10th intercostal space on the side here. And that's dull. That's good. Okay, now I'm going to palpate, okay? So it's just going to be light first, and it might tickle a little. Okay, so light palpation. Any pain? No pain? Good. Now I'm going to do it a little deeper, okay? Good. Now I'm going to palpate your liver. It's kind of up under your ribs here. And I don't feel it. And I'm going to palpate your spleen. And I don't feel it, not palpable. I'm going to palpate your kidneys. Not palpable. Let's move to the other side. Palpate your kidney. Not palpable. And I'm also going to palpate your aorta. Good. All right, now I'm moving on to your legs. I'm going to inspect your lower extremities. I'm going to feel them for any swelling. I'm going to palpate your pulses. So down here behind your knee, popliteal pulse. Here behind your ankle, posterior tibial. And then here on top of your foot, dorsalis pedis. Okay. Now I'm going to do range of motion of your hips. So just with this leg straight, lift it straight up in the air for me, and then back down. Good. Now bend your knee, and then try to lift it towards your chest, and then bring it back down. Straighten it. Good. Range of motion of your knee. Just put your leg up like this, bend your leg, and straighten it out. Good. And you put your leg down. Now I'm going to have you, again, range of motion of your hip. Lift your leg straight, swing it out that way. Good. And then bring it back in. Perfect. Thank you. And then range of motion of your ankles. Can you point your toes up towards yourself and then straighten them down? And then your toes, can you curl your toes, straighten them out? Perfect. Thank you. Okay. Now I'm going to have you sit up. Scoot down here towards the edge. This is where we're going to do some light touch and sharp touch and soft touch, okay? So you're gonna close your eyes, and you're gonna tell me if you feel sharp or soft.
Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Soft.
Soft, good, okay. Now, still with your eyes closed, I'm going to take your hand, and you're gonna tell me if I push your finger up or pull it down.
Up. Down.
Good. All right, and then still with your eyes closed, I'm gonna put something in your hand, and you have to tell me what it is, okay? So that's in your hand, take a feel.
Keys.
Keys, good job. And that was checking stereognosis. Okay, now I'm gonna check your cerebellar function. Yes, cerebellum function. Okay, so this is where you're gonna do finger to nose, okay? So you take your finger, put it on your nose, and put it on my finger. Good. And then same thing, heel to shin. So you're gonna take the heel of your foot and run it down the shin of your leg like that. Awesome, and then do the same thing on that side. Great job. And then back up here on your neck, I'm gonna do range of motion of your neck. Okay, so we're gonna do this way, side to side, side to side. Good job. Down, up, good. And I'm gonna check the strength of your neck and of your shoulders. This is checking cranial nerve number 11, the spinal accessory nerve. So I'm gonna have you push against me as I put my hand here. Can you push against me? Good. And then try to push against me again. And then try to shrug your shoulders against my push. Good job. All right, you ready to stand up? Okay. Stand up. And we're gonna check the Romberg side. So you're just gonna stand just like this, straight. Close your eyes. Good. I don't see any swaying back and forth. And then you're gonna open your eyes. And then you're gonna walk heel to toe for me. So heel to toe. Perfect. Good job. Okay, you can go back towards the bed there. You can stay standing. And you're gonna do a shallow knee bend. So you're just gonna bend your knee like that. And bend your other knee. Perfect. Thank you. Now turn around. Scooch back this way just a little bit. You're gonna bend over and touch your toes, and I'm gonna look at your spine and make sure you don't have any scoliosis. And that was straight. Good. You go ahead and stand up. All right, and face me. We're gonna do range of motion of your spine. So you're gonna do side to side bend, and then rotate, rotate. Awesome, great job. Popped your back. Good job. You've been a great patient. So before we end, I want to look at my card just really quickly and make sure that we got everything, okay? So sit back up here for me. And this is my 3x5 card. Looks like I did all of that. Okay, I know one thing that I wanted to do as well, and that was check your reflexes. We've got to do that one. But otherwise, I think we did everything. Yay! And you are an excellent patient. Awesome. Okay, so we're going to do your reflexes, okay? So we're going to do biceps first. Good. And then we're going to do tricep. Good. We're going to do brachioradialis. Good job. We're going to do your patellar. Good. And then we're going to pull this out. We're going to do your Achilles. Good job. And then we're going to do the Babinski sign. Good job. And then the very last thing, and then we'll be all done. On your back here, swing around. Stay sitting up. And I'm going to feel for CVA tenderness. Tell me if this hurts. Does that hurt? Any pain there? No? Okay. Awesome. You can turn back around. You've been an awesome patient. Thank you so much.
now that we're done with your health history and your vitals, we're going to go ahead and do an assessment. This is a well-nourished, appropriately developed for stated age, school-aged female who appears to be in no acute distress. All right, honey, we're going to go ahead and we're going to start with your skin tonight, okay? Check your hair and your scalp. Okay, any of that hurt? Okay. All right, can you smile for me? And frown. Can you puff out your cheeks? Okay, close your eyes. Don't let me open them. Good. Okay, next we're gonna do some touch sensation. All right, can you tell the difference between this and this?
No.
Okay, I want you to go ahead and close your eyes, and I'm going to do this on your face, and I want you to, each time I touch you, I want you to tell me what you feel, okay?
Sharp. Dull. Dull. Sharp. Dull. Sharp.
Good, okay. Now this is light touch. Each time I touch you, I want you to point to where you feel it, okay? Okay. All right. I want you to, okay. Can you bite down? Okay. Can you move your jaw from side to side? Good. Up and down? Okay. All right. Can you shrug your shoulders? Good. All right. So next we're going to go ahead and look at your eyes, okay? All right. Just look straight forward for me, okay? Okay. Look straight forward. Good. Okay. All right. First, can you go ahead and follow my finger with your eyes? Okay. And out here? I want you to look straight ahead, okay? Straight ahead. Okay. Okay, good. All right. Next, we're going to go ahead and look at your ears, okay? Go ahead and look around. Okay. Good. Okay. Next, we're going to check a little bit of your hearing. Okay, I'm going to hit this, and then I'm going to place it on your head, okay? Can you hear that equally in both ears? Okay. How about this? Hold on. Is either one louder? That one's louder? Okay. How about this ear?
That one's louder.
Good. Okay. Okay. And now I'm going to whisper something, and I want you to tell me what I whisper, okay?
Dish.
Good. Okay. So now I'm going to go ahead and we're going to check your tongue, your mouth. Okay. Go ahead and say ah for me. Say ah. Okay. Good. Can you stick your tongue out for me? Can you wiggle it around? Good. Okay. Next, we're going to look at your nose. Okay, can you sniff for me? This side? Okay. Put your head back a little bit. Good. Good. All right, so let's see. Just gonna feel around here for you. Just feeling for your lymph nodes, okay? Is any of this tender? No? Okay. None of this hurts you or bothers you? Okay, can you swallow for me? Okay. Go straight. You swallow again? Good. Okay. Okay. Okay, good. Now can you go ahead and turn that way for me a little bit? Okay. Gonna listen to your back. Okay. Okay. Can you take a big breath for me? Good. Okay. And the other side? Okay. And I'm going to be putting my hands on your back, and every time I put my hands down, I want you to say 99. Okay?
99. 99. 99.
Say a little bit louder.
99.
Okay, good. Now I'm going to be tapping on your back, okay? You let me know if any of it bothers you. Good. Okay. Next, I'm going to take a big listen, okay? Each time, you know what, can you turn a little bit this way? Okay. Each time I put the stethoscope on you, I want, stethoscope's falling apart. I want you to take a big breath, okay? And let it out for me, okay? Big breath. Good. Another one. Good. Great. Okay, and one more thing back here. Does that hurt? Okay, great. Go ahead and turn back around this way. Okay. All right, put your legs down for me, okay? Arms on your side. Just breathe normal for me, okay? Okay. Okay, I'm going to take another listen, okay? Same kind of breaths, okay? Big breath out. Good. Big breath out. Great. Okay. Okay. Just breathe normal, okay? Okay. I'm going to listen to your neck. I want you to go ahead and take a normal breath and hold it for me. Good. Okay. And again. Good. And again. Good. And one more time. Good. You okay? Okay. Okay. Just go ahead and Lay back on the table for me. Scoot all the way back so your legs are on the table. Good. Good. Get as comfortable as you can. Okay. Okay. Just going to feel around for your lymph nodes down here, okay? Great. Feel your pulse right here, okay? All right. Now I'm going to be doing that on your belly again, okay, like I did on your back. Next, I'm going to come around here. I'm going to be pushing on your belly. I want you to let me know if any of this bothers you, okay? Any of that hurt? Good. Okay. I want you to take a big breath in and let it out. Okay. Try a little bit on your hip. Okay. One more time. Big breath in and let it out. Okay. Good. All right. Well, I've got you laying here. Put your arms down for me and check your other pulses. Okay, put your legs out for me. I'm going to switch to the other side. Okay. All right. Can you lift this leg up for me, straight up? Good. Does that bother your back? Okay. About this one? Good. Okay. Try to lift your legs up for me. Good. And here? And here. Good. All right. Can you press on my feet like a gas pedal? Or my hand? And that one? Good. Okay. Relax your leg for a minute. Okay. Move your ankle from side to side. Good. In and out. Good. Any of that bother you? Okay. Okay, move your ankle from side to side. Good. Any of that bother you? Good. Okay. All right. Check your pulses back here. Okay, and your pulses down here. Okay. and your pulse is right on your feet. Okay. All right, go ahead and have you sit up again. We're almost through. Okay, to the edge of the table. Good job. Okay. Now, can you reach your hands above your head? Okay. How about behind your back? Does that hurt? Good. Okay, put your hands out like this. Don't let me push them down. Good. And your hands? Don't let me push them down. Good. Now don't let me push them in. Push. Good. All right, just relax them for me. Okay, can you move your wrists in and out? Good. Up and down. Good. Okay. Move your wrist side to side. Good. And up and down. Any that bother you? Okay. All right. While I have you here, can you place your hands right on your lap and flip them back and forth? Good. And how about, can you take your heel of this leg and run it down your shin? Good. How about the other one? Good. All right. And how about, can you take your finger, touch your nose, and then touch this as fast as you can? Good. Good, good, good. Okay. All right. Now we're going to go ahead. I'm going to put something in your hand. Close your eyes. I'm going to put something in your hand. I want you to tell me what it is, okay?
Key.
Key? Good job. One more thing. Close your eyes. Can you tell me what that is?
Dime.
A dime. Wow, good. All right. And let's see. All right. Remember this thing? Okay. I want you to go ahead and close your eyes. Okay. I want you to tell me what you feel.
Vibration.
What?
Vibration.
Tell me when it stops.
Stop.
Okay. Tell me what you feel.
Vibration.
Tell me when it stops.
Stop.
Good. What do you feel?
Vibration.
Tell me when it stops.
Stop.
Good. What do you feel?
Vibration.
Tell me when it stops.
Stop.
Good. Okay. Go ahead and check your reflexes, okay? I want you to just relax your arm for me, okay? Good. Good. All right. Relax your arm for me. Good. Okay. One more, two more down here. All right. Ready? Good. Okay. And then your knees. Okay, just relax your legs. Good. Good. All right. One last thing. Back here. Good. One last thing on your foot. There you go. Checking that reflex. Good. All right. Now, okay, I'm going to have you hop off the table for me. Okay. Okay, I'm going to have you stand right here. I want you to walk to me regularly. Okay, good. Okay, now can you walk back for me? Good job. And then when you come back this way, I want you to walk with your heels touching your toes, one by one. Good. Good. Okay. And one last thing for me. I want you to put your arms up like you're going to dive in a pool and bend over. Good job. Okay, you can go ahead and stand up for me. And check your legs. Good. Well, Avery, I think we're all done today. Good job.
Come in.
Hi, Addison. I'm Ashley. I'm going to do your assessment today, okay? First, let me wash my hands.
going to check you out from head to toe, okay?
Okay.
Before this, we checked your vital signs. Your vital signs were good and appropriate for your age. We checked your eyes. Your vision was 20/20. We used the Snellen and eye chart. We checked your hearing with the OAE, and your hearing was great as well, okay?
Okay.
All right, so can you just put your legs up for me?
Yeah.
Just going to start off by checking your head out, okay? Just going to give you a massage. Feel if there's any bumps or lesions or anything. Good. Your hair is soft and thick.
Thank you.
Just going to feel your ears. Cartilage is well formed in your ears. Just going to check your... Good. Can you swallow for me? Good job. Just going to check your eyes, okay?
Okay.
Just look straight ahead. Good. Your eyes are reactive. 3 millimeters. Just follow my finger with just your eyes. Good job. Can you squeeze your eyes together real tight? Good. Can you stick out your tongue? Good job. Okay, I'm just going to look up your nose. You had allergies going on lately?
Yeah.
Okay. Can you blow out this side of your nose? What about this side? Good. Just check your ears. Look this way. Tympanic membrane is pearly gray. It's also pearly gray in this one. Can you open your mouth and say, ah? Uvula has good movement. Just need to check out your tongue. Look up. Good. Hard palate is intact. Let's smile. Good. Teeth are in great condition. No cavities seen. All right. Now we're just going to check your arms out, okay?
Okay.
Skin looks good. No rashes are present. Good. Squeeze my hands. Grip is equal bilateral. I'm just going to play a game with you. Let's arm wrestle. Strength is good in the right arm. Equal in the left. Push out. Good. Can you shrug your shoulders up? Good job. Okay. Just going to feel your pulse.
Okay.
Good. Let's check this pulse. Just relax your arm. Good. Check these pulses. Pulse has got a regular rhythm, bilateral, and normal rate. Just going to check your capillary refills. Capillary refills are less than 3 seconds, so that's good. Just going to start off by listening to your lungs, okay? So I'll just need you to take a big deep breath each time, okay? Big deep breath. Good. Again. Once more. One more. Good. Just gonna listen in the front. Good job. Good. I'm just going to listen to your heart, okay? That's your heartbeat. Heart rate is normal. With a regular rhythm. Good job. going to have you lay down for just a second. Just going to listen to your heart rate again, okay? I'm just going to check your belly out, okay? Just lay flat for me. Abdomen is flat. No distension noted. I'm just going to listen, okay? Bowel sounds heard in all 4 quadrants are normoactive. Just anything hurts, just let me know, okay? Good. Okay, just turn your legs this way. Yeah. Good. Okay. We've got normal hair distribution on the lower extremities. No rash noted. I'm just going to check your reflex in your leg. Just relax your leg for me, okay? Good. Let's do this side. Good. Reflex is good. Capillary refill and toes are less than 3 seconds. I'm just going to feel some of your pulses, okay? Popliteal bilateral are 2+. Good. Posterior tibula is 2+ bilateral. Dorsal pedius is 2+ bilateral. Can you push down like you're pushing a gas pedal? Good range of motion in the foot. Another good range of motion in the foot. Does this hurt?
No.
Good. Okay. Can you close your eyes for me? Can you put your arms out? I want you to use this hand to touch your nose with your eyes closed. So you're going to do this. Keep your eyes closed doing it though. Good job. Okay, next what we're going to do is, I need you to do this. You're going to take your foot, put it like this, and run it down your shin. Good job. And the other side. Good. All right. Next, what we're going to do is hop down. Good job. Okay. You're going to stand on the line. Get on this line.
This one?
Mm-hmm. You're going to walk heel to toe. Great job. Now can you squat down? And can you walk like a duck? Good job. All right, now I'm going to check your spine, okay?
Okay.
First, can you just bend over and touch your toes? Good. Now come back up. Now I'm going to lift your shirt up in the back just so I can see your spine, okay? Then back over and touch your toes. Spine is normal. Okay, let's hop back up here on the bed. All right. I need you to close your eyes for me, okay? Now, this is your right arm. This is your left arm, okay? With your eyes closed, I want you to tell me what side I'm touching, okay?
Left arm. Right leg. Right arm. Left leg. Right hand. Right foot. Left hand. Left foot.
Good job. I want to thank you for letting me do your assessment today, okay?
You're welcome.
Thank you.
Thank you.